We're going to take a look at the dorsal knee for the location of a possible Baker's cyst. Therefore, before we go exactly to the location, which is here, it's sometimes difficult to find if you're unexperienced, so it's easier to start more proximal. Because more proximal here, we will have the semitendinosus tendon in this direction, and just beneath it, we will have a muscle belly. So mostly what happens is that people start scanning and they don't scan here, but they scan more here. And there you can see a tendon as well, but that's the gracilis tendon, and they think that that's the tendon of the tendinosus. So we need to scan it more on the dorsal side. If you have any doubts, just ask the patient to hold the foot up, give a bit of resistance. I palpate, you can actually see it here. This is the semitendinosus tendon. So you can relax now, keep my finger on it like this, take my probe, look at the right angle, other way around, exactly. And then I know that I'm exactly in the middle of my probe should be the tendon. There we go. So if I scan here, I see here it's very superficial, a very nice tendon, and beneath it I see a very big muscle belly. And the tendon here is the semitendinosus. This big muscle belly beneath it is the semimembranosus. And we call this image sometimes the cherry on the cake, because this looks a little bit like a cherry on the cake. We go a little bit more proximal. You will see the myotendinous junction of the semitendinosus with the muscle belly. So the myotendinous junction. If we go, now we have a cake on a cake actually. We go a bit more distal. This cake disappears, and now we have a cherry and we have a big cake. What we do, we put this in the middle of our image. Here we have a nice marker for the middle of our image. We keep this in the middle of our image, and then we follow this one distal to distally. And then we see that the semimembranosus muscle becomes smaller. You see it becomes smaller, smaller, smaller. And now this here is the tendon of the semimembranosus. This is the tendon still of the this is semimembranosus, this is semitendinosus. And here, in the depth, we see very clearly the cortical bone line on the dorsal side of the femur, with the femoral cartilage above it. So that's a very nice, this is actually a very nice image. The problem is with a lot of your patients that you're going to be scanning, it's not going to be as pretty as this. So let's see, what else do we see? We have the tendons on the right, and then here we have the big muscle belly that we see right here. That's the muscle belly of the medial head of the gastrocnemius. The medial head of the gastrocnemius has its tendon or its aponeurosis very much on the medial side right there. So if I point here, this here is the tendon or the aponeurosis of the medial head of the gastrocnemius. You can see it's a very nice hyperechoic structure, and it looks a bit like a moon shape or a C or a reverse C shape in this case, and we see the tendon right there. Okay, so now we have identified all the tendons, we have identified the cartilage, and at this point you can see that between the semimembranosus, which is this big tendon right here, and the medial head of the gastrocnemius right there, in between there, that's where the capsule can break and fluid can come out, and a bursa will arise, and it will, a Baker's cyst will arise, and it will usually go here superficial to the medial gastrocnemius head. One thing to note is with some people, it's impossible to get both of them hyperreflective, so I'm gonna simulate this a little bit for you, because with him it's actually quite well seen. First I'm gonna make this tendon hyperreflective. You see here, this is the semimembranosus, and actually when I do that, we see that this the comma-shaped or the reverse C-shaped tendon of the medial head of the gastrocnemius becomes full of anisotropy. And a lot of unexperienced sonographers actually think that this is fluid inside a bursa. This is or in a Baker's cyst, and this is not a Baker's cyst. This is anisotropy, because if I angle the probe now, I'm going to angle in that direction. You're going to see that the tendon of the medial head of gastrocnemius will become hyperechoic, and the tendon of the membranosus will become hypoechoic or full of anisotropy. And I call this sometimes the yin-yang, because now this is yin and that's yang, or the other way around, and I do this, and then it's the other way around. Yeah, this one becomes black, this one stays white, and you can yin-yang in between, and then you know that between these two tendons, that's where the Baker's cyst will arise.